But what we really want them to understand is conceptually to really understand a disease process or a patient. They start with concept-based learning activities that they don't do any patient care. They really just go in and focus on this concept that we want them to understand. They initially start with just understanding a patient's story. You know, just going in and really understanding, forming a relationship with a patient and how important that is, and hearing the patient's story and side of, and their belief about their health care and their health and wellness. And then we build upon that, so every time they go in and talk to a patient, they still have that concept that they're dealing with, but we also know that diabetes is a very prevalent disease, especially in our area, and they'll deal with it wherever they go. So we have a whole concept-based learning activity specifically on glycemic control. And so they don't do any patient care, but they'll go in and interview patients who have been identified by their clinical instructor as having diabetes or at risk for diabetes, and they'll ask them questions related to that, about their wellness, their health, how they manage their diabetes at home, and then they go to the chart and start to investigate different medications, different treatments, different histories, different hemoglobin A1Cs, and all of that, so that they're really looking at probably 10 to 12 patients who have this disease process, and then comparing and contrasting the treatments and the treatment choices that the patient has made, the physicians have made, and realize that it's just not a cookie cutter treatment plan. They really have to take the person's lifestyle into account and all of these things, and then there's some reflection after that. And so we do that for many of the prevalent diseases that are up here in the Northwest.
Oh, that's great. And you know, you call it concept-based clinical, but you could also call it concentrated.
Exactly.
Because they're not all over the place. They're really honing in on an area that they're going to have to master.
Right.
So,
and it was very exciting, if you don't mind me just taking on just a little bit. We do that predominantly in the first year of our program, and then as they become more proficient in that foundational layer has been kind of solidified for them, then we start doing more focused or direct patient care. And it was interesting, and one of the turning points for our faculty in the clinical education redesign was some of the students wanted to meet with the faculty to discuss concept-based learning, and they were our second-year students. And I thought, oh no, here we go. They're going to start talking about what a waste of time their first year in the nursing program was, and how it didn't help them, and it would give the faculty who really didn't buy into it that much a little bit more ammunition to change back. And the students actually said, you know, those concept-based learning activities that we did a lot in the first year, why don't we do them in the second year? We need to do some in the second year because our patients are more complex. We're doing different things, so we want to be able to do them to really understand more.